Hello, welcome or welcome back to my channel. My name's Ashmita, and in this week's episode of Living in the Pandemic, I'll be continuing to discuss the psychological impacts. However, I'll be discussing the psychological impacts of the pandemic on the elderly and the frontline workers, as well as some potential solutions to the problems. So it is a known fact that the more vulnerable someone is to contracting the virus, they'll have a much more fear-induced or frightening experience of the pandemic. So for seniors, this is especially true because obviously they have a relatively low immune system. Therefore, they have more anxiety and fear inside of them. There was a study that was carried out in China where they investigated the mental health of seniors, and they took in factors into consideration such as gender, age, chronic history of illnesses, previous history of mental illnesses, and then education level if they were married or not, so their marital status. And more. What they found out was that 37.1% of the seniors were more prone to facing anxiety or depression, and they had gender differences, so they had a higher impact on female seniors. Additionally, those who were either widowed, living alone, or divorced, had a low level of education, or had sleeping problems, were more vulnerable to facing anxiety or depression. Furthermore, social distancing does cause loneliness, and this is much more extreme for the elderly because they are not as comfortable with technology as we are. Therefore, they can't really contact their loved ones frequently. The pandemic is also quite difficult for those who are experiencing dementia or cognitive decline. One of the potential solutions to this problem is that one should increase their attention to the people who are more vulnerable to the pandemic in terms of their mental health. Furthermore, if the emotional response is more serious in the elderly, then they should either consider having an online consultation or having a conversation with a psychological hotline. For long-term solutions, the psychological crisis intervention and psychological counseling should be improved, especially in a situation like a pandemic. The last topic that I'll be discussing is the psychological impact of the pandemic on frontline healthcare workers. So because frontline healthcare workers are confronted into the unsettling situation daily, they either develop anxiety, depression, OCD, or insomnia because they have a risk of contracting the virus and spreading it to their families. There's also a sense of helplessness to some of these frontline workers, especially those who don't have PPE for themselves because they can't protect themselves from the virus, and those who cannot provide enough beds or appropriate equipments for these patients. This also leads to work-related trauma because if a frontline healthcare worker loses their patient to COVID-19, it can have a detrimental impact on their mental health. Frontline healthcare workers also have to make choices that involve their families because they work in such a high-risk situation. Their families can't visit them, and this leads to moral injuries, which is the term that refers to the psychological distress of perceived injuries, which can impact their mood or self-esteem. On top of this, they also have almost no social support. So when stress levels are high, social support does play a major impact in reducing them. However, since they work in a high-risk situation where they can spread the virus to whoever's around them, they obviously can't have this social support. So one of the potential short-term solutions that can be done is that hospitals can implement infection prevention measures and have enough PPE, and also provide frontline healthcare workers with practical guidance. However, for long-term solutions, there's a much more challenging approach, which is to either identify those who are at a high risk psychologically and provide them with adequate support. Additionally, they can develop interventions to lower the risk of long-term psychological impacts from occurring. So, That concludes the 7th episode of this series. In the next few episodes, I'll be discussing the epidemiological impacts and the social impacts of the pandemic. As always, if you guys have any questions, comments, or thoughts, please feel free to leave them down below. Until next time, see you. Bye.